Welcome back, everyone. My name is Oren I'm with Rebalancing Health Physical Therapy. I specialize in the treatment of chronic pain, and again, thank you for joining me once again on these educational videos. Well, today is a very special one because today I get to reveal the secret sauce that is extremely helpful in treating chronic pain. As people ask me, so what is it that you do that's different to most other not only physical therapists but practitioners who treat pain? So one of the first things that got me to doing what it is that I do today was a word, one word, and that word is tight. I noticed that the patients would come in and they would say that something is tight. And I'd ask them, what is the problem? Why are you coming to see me? They would say, I have tightness, or this area feels tight. But they're not only did they use that word tight, they used a whole bunch of other words and expressions that mean tight. I actually got a list made. I don't know if you can see that. It's all synonyms for the word tight. They'll say it's tight, it's tense, I feel restricted, all stove up. I get spasms, I have trigger points. This theme of tightness kept coming back. And so I knew that this tightness concept was a key element. And when something is tight, then we're told to stretch it. And it seems very, very obvious that if a muscle is tight, you need to stretch it. In fact, that's what I was told to do as a physical therapist in school. You have a tight muscle, go ahead and stretch it, because if it's tight, it needs to be stretched. And that was never challenged in any way. So here today, I'm going to challenge that idea that a tight muscle needs to be stretched. Okay? We have a situation when, for example, when we go in a car, we step into a car, or we sit down in the car, and we have that seatbelt. And that seatbelt is very stretchy because we can pull it out and we can retract it. And we can do this stretchiness thing all day long and there's no problem. However, if you're driving and then there's a car that you need to avoid and you slam on the brakes, that seatbelt goes tight. It becomes tight. Can you stretch your way out of that? Will it be helpful to push harder? No. Why is that? Just because it's tight does not mean that it needs to be stretched. So basically, the seatbelt was stretchable as long as it was in the normal state when there's no emergency. But once it went into the emergency state, it became non-stretchable. Now, stretching is not going to help you to get out of that situation. You have to do something to undo the mechanism that made it non-stretchable. Does that make sense? So this very, very similar thing happens in the body. A muscle in the normal state can be stretched and it's fine. There's no problem with stretching a muscle. In fact, it's very good for us to do stretches and so on until a muscle feels tight. The usual reason why a muscle feels tight, especially with patients who have chronic pain, is because the body has now gone into an emergency state. The sympathetic state, fight or flight state, it's an emergency state, and it's not able to come out of that emergency state, which is why the muscles remain tight. And now stretching is not going to help you to get that muscle loose, because the tightness is dictated by the nervous system internally. And what you're doing by stretching the muscle now is you're only stretching a tightened muscle, which puts a lot of strain on the muscle, because the muscle is not really going to give. It's being given a signal to contract by the nervous system, and you are giving it force to stretch it. So it's not going to help you to get out of the situation. So what is the solution? Well, the solution is to, just like with the seatbelt, we had to use the built-in mechanism that tightened it to untighten it. In the body, it was the involuntary nervous system that caused that muscle to be tight. So we have to use the involuntary nervous system to untighten it, to undo the mechanism. And that is essentially what I do. And I can teach you also how to do that yourselves. Because whenever we have an involuntary reflex that tightens muscles, for example, if an object is coming towards my eye, I'm going to involuntarily contract certain muscles in order to protect my eye. By the same token, other muscles are being forced to relax by the same involuntary nervous system. And just having the knowledge of which muscles contract and which muscles relax, we can reverse engineer it so that we activate involuntarily the muscles that we force the muscles to relax, but it's the involuntary nervous system that is making those muscles relax. So there you have it. That is the engine, the driving force for breaking into the pattern of chronic pain, because chronic tightness, as we said before, is unsustainable. It's like holding an object. It can be a light object, but it's like holding an object for hours, days, years. And that tight muscle is going to cause problems in lots of different areas until we are able to undo that mechanism. So anyway, thank you for listening. And next time, we'll be talking about how this is one of the most important ways to get a lot of benefit, a lot of relaxation in the body that you're not able to get by stretching, and you're not able to get by consciously using your voluntary nervous system to get out of. Thank you, and we'll see you next time.